Hi everyone, Candace Heron here, nurse practitioner from Hometown Primary Care. And I wanted to talk to you guys a little bit today about weight loss medication and what I feel it is. It is a tool. Just like we use anything else as a tool to help us get better, feel better, get to our goal, this is what we do with weight loss medication. So, I wanted to talk to you guys a little bit about why there's such a stigma. We put people on blood pressure medicine and on diabetes medications, on high cholesterol medications. We put people on medications for depression and anxiety at a much higher rate than we do on weight loss medicine. So, why is this? Often, it's because people think they should be able to do it on their own, that they are cheating, that this is not really them putting in the work, and that they're taking the easy way out. I hear all of these things every single day. But I would like to remind you all that we use these tools to help lower the risk of other disease processes that losing weight will help you to not get and prevent these other diseases. So there are 119 million people in our country with high blood pressure, which means 1 out of every 2 people is affected by this and are on blood pressure medications. No one ever bats an eye if you say you're on a blood pressure medicine. Now, there are roughly 30 million Americans with diabetes, type 2, so preventable, which means 1 in every 8 people have diabetes. That means 20 to 25 million diabetics are on medication. No one ever says anything about that. But when we look at obesity, which might I add, is the single highest driver for diabetes and high blood pressure. And in 2022, 107 million adults were obese, which is 42% of our population. But only 6% were on a medication to help them lose weight. Now that has increased some with some of the newer weight loss medications, but did you know that someone who has a BMI, which I know it's not an amazing indicator, but it is what your insurance uses and what our healthcare system uses to say, hey, this person is obese or overweight or within a healthy weight. So if you are 30, if your BMI is 30, you are 28% or 28 times at greater risk for developing diabetes in comparison to those who have a healthy BMI. Did you know that the risk jumps up to 93 times higher if your BMI is 35? So why is weight loss medication not covered by insurance as a preventative measure of these other diseases? Why is it that whenever a healthcare provider like myself put on a insurance claim that we are treating someone for obesity and we are treating them with a BMI of 30 to 35 or even 40 to 50, that your insurance company can deny that claim? It is actually a very high likelihood they will deny it if those are the only 2 problems, without it saying that you already have diabetes or high blood pressure or heart disease. So why can they deny that if they truly are trying to prevent disease and want you to be well? So they are not covering your blood pressure medicine and your heart procedures such as angiograms and CABG surgeries. And why are they not just covering weight loss medicine, weight loss visits that have nothing else in the visit? Because we are trying to help you, whether that be with medication, whether that be with dietary recommendations, or with any other tools that we have at our disposal. and they are telling providers they are not paying. They won't cover that visit because it has been seen as a cosmetic issue, not a health issue. So this kind of stems back to there is a a federal law exclusion where Medicare said that Part D does not have to cover medications prescribed solely for weight loss. This dates all the way back to 2003. And so if you don't know this, most of the insurance companies that are private insurance do follow Medicare's guidelines. So if Medicare does it first, then they usually will follow suit. So Medicare said they will not cover medications for weight loss. There's a perception that, of course, it is cosmetic rather than medical necessity. And that's despite the fact that the American Medical Association said in 2013 that it most definitely is a chronic disease process. So if it is a chronic disease process, if there are medications to help you, and if you have other comorbidities, they will cover it. But if you do not have those yet, they will not cover it. And there's only certain criteria that they will cover it. Some plans completely exclude weight loss medications. And so that has driven the market for cash pay weight loss medications. Even the big drug companies have their own cash pay services. Why? Because your insurance company says they won't cover it. How do they get that say whenever you are the one paying them? You pay them every payday through your employer. You pay them co-pays, deductibles. You pay all of this money out, and you don't get a say what is covered. And you also don't get a say in who you get to see if you have certain insurances. How is that okay in this day and age for them to tell you what you can and cannot be prescribed when your provider feels this is what is needed and you feel like this is what is needed and you have come to a shared decision that this is where you would like to go? Insurance should not be able to say if they will cover it or not because you have paid them. I could go on about this forever. And if you don't know me, my least favorite thing in healthcare is dealing with insurance companies. And this is because they are not in this to care for patients like providers are. They are not in this to make sure you are healthy and preventing disease processes. They are in this to pay for sick care. The sooner we understand that in America, the better off we will be. And as a primary care provider, this is so sickening. This is so against everything that we go to school to learn to help people. Now, if you think that you shouldn't be on a weight loss medication, that's completely your choice. If you think that you can do this on your own and lose weight, please do that. If you think that other tools such as working out, eating right is enough and you can lose the weight, I am so proud of you. If you need medication to help you lose weight, I'm also proud of you for coming and saying, I need this and I need your help. And I trust that what you tell me is what I should do. Because all that we want as healthcare providers is for you to be healthy, happy, and able to have a productive life and live to the fullest for as long as you can. So I ask again, why are we not preventing other disease processes by helping people lose weight any way we can that is safe and healthy for that person? Thank you. I hope you guys have a great day.